Good morning, everybody. My name is Kevin Muir. I am the Senior Program Director at CAMBA, working on the Health Homes program. CAMBA is in a unique position in both providing housing services to folks and also providing health home services. So we're doing both of these things together. And so the struggles that we're all going through in terms of defining the various roles of the care coordinators that are in care managers that are in health homes and the case managers that are in housing, and defining those different capacities in terms of our common clients. We're going through that same kind of struggle, and I think that's going to be the conversation that we're going to have today during this hour. We're going to be looking at those different roles and some of the other things about health homes. The first topic that I wanted to kind of introduce is the idea that the health homes is a very complex system that's being implemented over an entire state. So when we say health home, there isn't any one sort of definition of what that is to people. So it all depends on your vantage point, your perspective, where you're coming from. And then it also depends on who within the health home system you're talking about. So we all sort of have a different view of it. And what I'm referring to is that New York State Department of Health is implementing the health home system at the state level. And then the managed care plans that are Medicaid managed care plans that are in New York State are also very much a part of implementing health homes across the state. So that's another level. And then the third level is really the designated health homes. These are entities that have been designated by New York State to provide health home services. And then the fourth level, which is yet another level that we have to talk about, is the care coordination and care management level. So the providers in the community that are actually providing care management to the clients in the community. And that's what CAMBA does. So we're coming from that perspective of the care management provider perspective. But then there's all these other different levels. So when you hear the term health home, it's not necessarily as simple as you might think, and you have to kind of think about those different levels when you're talking about it. And so as we're talking today, we'll talk more about that. The other topic that I wanted to bring up in terms of talking about roles is that health homes is a program that does have limited funding in terms of what's available for care coordinators and care managers to do. So when we talk about health homes, there are a lot of different things that people say that health homes will do, and in many of those instances it's true that health home care managers can do those things, but it's not one set role. We're all used to having a very clear set of guidelines that are provided to us that say, for example, that you must see your client once a month in their home. You must go visit them in their home once a month. And that's one of the core services that you provide. In the health home program, there are core services that we have, but they're not as specific as a set of kind of rules that you must follow every single month. And so as a result, we have some flexibility. That can be a good thing. We have some flexibility that allows us to be able to provide the services that any one individual needs, as opposed to the government regulated services that must be provided to any one person. So we have some flexibility, but that also creates confusion about what are the different roles that people have. So your case managers in a housing program may have specific roles. Our case manager may be a little more flexible. And so as a result, it creates a lot of confusion around what exactly is health homes. And the reality is that it's a model that's intended to try to serve many different kinds of people at many different levels. So any people from very low levels of need to very high levels of need. And we are looking at each individual and saying, what does this person need from us in order to keep them from accessing emergency services, from going into the hospital, from transitioning out of the hospital back into the community, staying in the community rather than going back to the hospital again. That's our real focus, is on medical stuff. But one of the things that I've been hearing a lot from folks is that health homes is sort of the answer, like health homes will handle it. And that's a real concern when you look at the funding for the program, that it's not true that health homes will be able to handle all of the problems that our clients are facing. And we need to create a very, very strong partnership with our housing providers and rely on housing providers to be able to serve our clients. And when there's a housing provider in the client's life, when there's somebody, a case manager from a housing program that's in the client's life, that person needs to be fully engaged with that client, even though there may also be a health homes care coordinator or care manager there as well. So I say that because the issue of funding and how the program is funded is very complex, but also I think influences the way we talk about the different roles that we have. The other topic that I wanted to bring up before we introduce Laura is that this is really a very much a market-driven program. It's not again, I talked about the fact that there's not specific regulations being put down on us. When I say it's a market-driven program, what I mean is that we're basically being given some very general guidelines from the state that influence how a health home might form. But many different health homes are forming around the New York City and around the state that are very, very different. They look very, very different from each other. So you might have in Brooklyn, we have 4 designated health homes, but each one of them is different. And when I say market-driven, what that means is that the health home that's done the best job in forming itself and meeting the goals of the program, that one health home of the 4 in Brooklyn, that health home is the one that's going to succeed. And maybe 2 of them will succeed, and maybe 3 of them will succeed, and maybe 1 won't. And I'm not particularly looking at any one. I'm not focusing on any one health home, but I'm just saying that the idea is that in a marketplace, you might have successful businesses and not successful businesses, and the state is really viewing it that way. So they're really putting a lot of the development of the health home on the individual health home providers, the care managers, the designated health homes that I talked about, the managed care plans. And all of us together have to come up with the solutions that are going to work to get the outcomes that the state is really looking for us to get. And the ones that can do that are going to be successful at it. So we really are being forced to come together in a way that we have never done before. People, I frequently hear people refer to the memorandum of understandings that we have and those documents that we used to have filled out, or we still have filled out for funders. And people would always say to me that this isn't worth the paper it's written on. The agreements that happen in the health home program are different in the sense that we really are having to work together to make the best possible outcome. But again, what that creates is people have different views of what health home is. And so you might have one health home that's being created that looks differently than the health home sitting right next to it, and that can cause confusion. So we do have to look at this from this in terms of New York City. We have to look at this from both an individual local area perspective, what's going on in Brooklyn versus what's going on in the Bronx or in Queens, and then we also have to look at it from a city perspective as well, because we are all sort of facing some of the same pressures throughout the city. So we're going to talk about all of these different topics today and try to get into them in the next hour. But I just kind of wanted to introduce a few of those points just to sort of guide the conversation and get us started.